Eculizumab, complement C5 inhibitor, monoclonal antibody, used for the treatment of atypical hemolytic uremic syndrome to inhibit complement-mediated thrombotic microangiopathy. Unfortunately, eculizumab is not indicated for the treatment of patients with Shiga toxin, Escherichia coli-related hemolytic uremic syndrome, and used for the treatment of refractory generalized myasthenia gravis in adults who are anti-acetylcholine receptor antibody positive, and for the treatment of neuromyelitis optica spectrum disorder in adults who are aquaporin 4 antibody positive, and for the treatment of paroxysmal nocturnal hemoglobinuria to reduce hemolysis. Off-label use for the treatment of antibody-mediated rejection of heart transplant, perioperative desensitization, and for the treatment of antibody-mediated rejection of kidney transplant and kidney transplant perioperative desensitization. U.S. boxed warning: serious meningococcal infection. Because of the risk of serious meningococcal infections, eculizumab is available only through a restricted under a risk evaluation and mitigation strategy REMS. Mechanism of action: eculizumab is a humanized monoclonal IgG antibody that binds to complement protein C5, preventing cleavage into C5a and C5b. Blocking the formation of C5b inhibits the subsequent formation of terminal complex C5b9 or MAC, membrane attack complex. Terminal complement-mediated intravascular hemolysis is a key clinical feature of paroxysmal nocturnal hemoglobinuria or PNH. Blocking the formation of membrane attack complex results in stabilization of hemoglobin and reduction in the need of RBC transfusions. Impairment of complement activity regulation leads to uncontrolled complement activation in atypical hemolytic uremic syndrome, AHUS. Onset of action for PNH: reduced hemolysis in less than or equals to 1 week. Distribution: 5 to 8 liter. Half-life elimination: 270 to 414 hours. FDA approval date is March 16, 2007.